Welcome to my channel. My name is Dr. Izzy. Today we're going to be talking about semaglutide, the weight loss wonder drug. Semaglutide has been offered as an option for weight loss, but it also has to be alongside a reduced calorie diet and an increased physical activity in adults. Please don't give it to children for a maximum of 2 years. I have chosen semaglutide because in comparison to all the other medications, it's been found that from trials that people have lost 12% more of their body weight on semaglutide than the other ones. So what is semaglutide? Semaglutide is a group of medications called GLP-1 receptor agonist. Big name, but don't get phased. It just means that it is a drug that binds to the inside of a cell and changes the activity of the cell. Semaglutide works by increasing the amount of insulin produced in the body. So if insulin goes up, sugar comes down, and that's exactly what we want. So it reduces the level of sugar in the body. It also works by reducing the amount of a substance called glucagon. Glucagon is produced by your pancreas, and glucagon helps your liver to produce more sugar. So by reducing the amount of glucagon in the body, it helps to reduce the amount of sugar in your blood, which is what we also want. Semaglutide also works on your stomach so that food passes more slowly through it, which means that the sugar in your meals will get to your blood a lot longer, which will also mimic and allow your blood to have balanced sugars. It also works by suppressing your appetite by mimicking the hormone glucagon-like peptide 1, which is released after we eat, and this helps to make people feel full, thereby resulting in people eating less and reducing their calorie intake overall. So you can either take it orally, which is as a tablet, or as an injection under the surface of your skin. If you're taking it as an injection, you take it weekly, and if you're taking it as a tablet, you take it every day. For you to have semaglutide, you have to have at least a BMI of 35 kilograms per meter squared, which means that you take your weight in kilograms and divide it by your height in meters squared. That's how you get your BMI. And you also have to have one weight-related comorbidity. What does that mean? So you could either have high blood pressure, diabetes mellitus, high cholesterol, sleep apnea, or even cardiovascular disease. And depending on your background, so you could be South Asian, Chinese, Black African, or Caribbean, they would allow you to have a BMI of at least 33 or 32.5. I've seen a couple of patients go privately, or that's an option, but it would be really nice to allow your GP talk you through it and also offer you other things in combination to semaglutide that will be of long-term benefits. So my advice would be, if you want semaglutide, visit your GP for more information. So one of the side effects that I have seen commonly with semaglutide is diarrhea. A lot of people would struggle with diarrhea, your appetite to be reduced, which is a good thing. Some people get burping, some people get inflamed gallbladder, some people get constipated, some people feel dizzy, they feel fatigued, and they just have a general, stomach discomfort. Some people feel sick, some people are vomiting, and the best side effect is that you actually lose weight. And more commonly, or in recent times, I've also seen some people get acute pancreatitis. And so if you are having vomiting, if you're having diarrhea, and if you're getting really severe abdominal pain, please visit your doctor. So I hope all of that information has been helpful. My personal clinical advice on semaglutide is that do not start taking it if you're not ready to modify your lifestyle. You want semaglutide to enhance your weight loss journey, but you also need to take responsibility for what you eat and how you move. NICE guidelines advises clinicians that they should consider stopping semaglutide if less than 5% of their initial weight has been lost in 6 months. So which means that you cannot just only rely on semaglutide, you also have to consider and want to do the work that it takes to actually maintain this lifestyle journey. And remember that with semaglutide, when you stop it, and with every weight loss method, you are more likely to regain all of that weight that you have lost. So it's really not about willpower, it's about setting lifestyle measures that would help you maintain in the long term the lifestyle that you have chosen. And if you do need help maintaining your lifestyle, please contact Dr. Izzy at www.drizzy.com for help.